I think you might be on mute, sorry.
Am I unmuted?
Perfect.
Great. Good afternoon, good morning, good evening to everyone that's joining us for the webinar on early prevention and health and safe child development. It's a webinar on presented by the UNODC World Health Organization on the international standards on drug use prevention. This is the first webinar for the Namibian chapter. And with that, I would just like to say thank you so much for the UNODC for agreeing to assist us with this very important topic, especially when it comes to prevention. For today, and just a few housekeeping issues, I just need to let you know that there will be certificates available within the next 24 hours for all the participants. And then the recording will also be available on the ISSUP website. And during the webinar, participants are muted and cannot turn on the cameras. But you could always just post your questions in the chat box and we will attend to them from there. I hope I have now, yeah. Just a brief introduction of our speakers for today. Dr. Wadih holds a PhD in mental health and drug addiction epidemiology from Johns Hopkins School of Health and a master's in public health in epidemiology and biostatistics from the American University of Beirut. He started working at the UNODC in 2005. He started working in the regional office for Middle East and North Africa, but at the moment he's at the headquarters in Vienna, working under the prevention, treatment and rehabilitation section. He currently coordinates the drug prevention program. And yeah, then we have Dr. Ziad Al-Khatib. Dr. Ziad is an associate professor in global health. He also works as an international expert for the prevention, treatment and rehabilitation section at the UNODC. He has a particular role in coordinating the process of development of the guiding document on defining the role of law enforcement officers on drug use prevention within school settings, including the training material. Yeah, and he's also evaluating interventions on interventions related to substance use prevention, such as the Lion Quest, which is a utility of digital health to communicate the UNODC's parenting skills to families in vulnerable settings. Ali Yassine, also one of the speakers for today, has 2 master's degrees, one in public and the other in international relations. He is an international public health specialist, also working for the UNODC under the section Prevention, Treatment and Rehabilitation. We have Ms. Su Hong, and Ms. Su Hong is supporting youth engagement and empowerment in drug use prevention through the Youth Initiative at the UNODC. She has a Bachelor of Science in Pharmacy and a Master's of Science in Clinical Pharmacy from the University, Seoul National University. Thank you. I think that is a very brief introduction. I'm sure when we listen to the presentations, we will get a lot of information from the UNODC team. And I thank you once again for being part of this webinar. I will give over now to Giovanna Campello to do the opening remarks.
Thank you, Leigh-ann. And thank you not only to Leigh-ann, but also to Radolf, Olivia, to the entire team of ISSUP, and welcome ISSUP Namibia to the ISSUP family. It's great to have you. At the United Nations Office on Drugs and Crime, we have a very, very fruitful partnership with ISSUP. As we work a lot to summarize the science about what works and what does not work. And ISSUP connects all of you and all over the world that are actually doing the work. And we are very, very grateful to have often the opportunity to connect with practitioners and professionals all around the world and share the science, learn from their experiences, and improve collectively all our work on prevention and treatment. Just one small thing. So I am the chief of the Prevention, Treatment and Rehabilitation section at the United Nations Office on Drugs and Crime. And as you can hear from the name of the section, we work on three main pillars, but they are not what you might think from the name of the section. The first pillar is prevention of drug use and risky behaviors. The second one is really around treatment and care for people with drug use disorders that have maybe started and have maybe developed dependence or other health and social problems. And we also work on promoting access to controlled medicines for medical purposes, particularly for the management of pain, while of course preventing diversion and non-medical use. But prevention is very, very dear to our hearts, and I will add my personal heart because it is originally the field in which I started to grow in the context of addressing the world drug problems, and is now one of our three main pillars of works. And unfortunately, I will not be able to stay with you throughout the seminar, but I leave you in some very good hands. Basically, as Leigh-ann has introduced to you, you have almost not 100%, but very close to 100% of our entire prevention team, and including, of course, Wadih, who is the leader of all our program of work on prevention, but accompanied by Ali, Dr. Ziad, and Sue, and that we present to you on different aspects of prevention and specifically early prevention. And I want to spend a couple of words on why this is important. Early prevention is incredibly effective. It really, by helping children grow healthy and safe, you prevent not only drug use, but many, many other risky behaviors. And however, sometimes it is difficult to convince policymakers to work on early prevention because they're not so familiar with this concept. And we have, through our advocacy, found that there is increasing interest on early prevention. Last year, our member states, the member states of the United Nations, endorsed a resolution on early prevention. So we are riding a good wave. And I'm very grateful for your interest in this aspect of prevention. And I really hope you will find this webinar useful and inspirational to improve our prevention, and particularly for children. And because I believe that from our science, we know that prevention works, evidence-based prevention works. It helps children grow healthy and safe. It prevents many risky behaviors. It prevents youth violence. It prevents crime. It prevents school dropout. It prevents mental health disorders, and it promotes mental health of children, the families, and the community. So I'm hoping that not only you will find this useful and inspirational, but I'm very much looking forward to working together and hearing from you and hearing from ISSUP Namibia about all the wonderful things that you will achieve embracing this very important part of drug prevention. With this, let me thank you, wish you a wonderful webinar, and get the floor over back to our chair. Thank you.
Thank you so much, Giovanna. We really appreciate, and thank you for the best wishes for Namibia. We will surely put it to good use. Dr. Wadih?
Yes, thank you, Madam Chair. And I just want to make sure that you can see my PowerPoint slides. I shared my screen. Yep.
Yes, we
Excellent.
can see it.
I'm going to project it just to be on the safe side. And if I'm not mistaken, I need to do just one click and you can see it clearly.
Yes, thank you.
Excellent. Thank you very much. Thank you again for the invite to present in this webinar. We're honored that it is the first one in the ISSUP chapter for East Africa, but from Namibia. But as Giovanna mentioned, this is not our first interaction with ISSUP. We're grateful for all the partnership we have. And let me echo the message from Giovanna as well, since I don't know if she's still with us or not, but part of what I'm going to mention about is the reason why it is close to the heart of Giovanna is aside the general guidance, the prevention standards that I'm going to talk about are the result of her hard work and guidance that made it present. And probably I will start with this general presentation on the prevention standards, moving into a bit of highlights on new developments that are happening within this field that colleagues that will join would dwell a bit on more details about them. So usually at the beginning, I'd like to just bring the audience on a common language, even though I know ISSUP colleagues are on the same channel, but the essential messages that we say in the standards are key to understand the prevention standards. The UNODC WHO prevention standards are a document that we use to talk to policymakers to change their perception of how they're addressing the prevention response, reflecting the fact that prevention is a science, that prevention is not raising awareness on drugs or raising fears about drugs. It goes beyond raising awareness. That there is a vulnerability framework that is larger than a personal choice of a person that can say yes or no to that person taking that risky behavior is not taking it out of a free and independent choice, but there's a vulnerability framework in the background that needs to be accounted for. That I will talk about a bit more detail later on. And that many of the interventions that are evidence-based in the field of prevention don't necessarily discuss drugs, but rather reflect on intellectual, language, cognitive, emotional, and social competency skills in different ages of development. And that's a key thing in terms of when we're thinking and reflecting in terms of what prevention interventions are taking place in the same country before we talk about what more do we need. And that reflection gives us a larger spectrum of what exists, and more importantly, on what infrastructure need to be implicated in the prevention response in a way that evidence-based prevention tend to focus more on the person, that personal development at different ages of development, rather than focusing on the drug being the issue. I usually have a slide reflecting the prevention standards in terms of how they look like, but probably most of you will know, and those who don't, feel free to contact us and we will share them with you. They carry now UNODC and WHO logo, and that is an extra value in terms of the strength and importance of the science behind this. So that's a general vulnerability matrix that we account for. There are personal characteristics, genetic susceptibility, mental health characteristics, things under the skin that a person has, a different way of reacting to stress, but that person exists in a context of family, school, peer, you know, the main social structures around the person that are interacting with him or her. But these structures are not standalone. These structures are in a larger macro influence environment that that affect the person directly. You know, income, resource, the social environment, you know, conflict, displacement, social inequalities, all of these things influence the person directly based on his or her characteristics, but also carry an influence on the structures around that person. You know, how the family function, how the school functions, and the peer influence also is affected. That's from one side. So basically, you can start to appreciate, just like talking about drugs or just saying no, in the context of what sort of personal characteristic the person have and the vulnerability in the structures around that person is barely scratching the surface. But more importantly, that vulnerability matrix reflects the fact that when we're addressing it this way, when we're focusing on that, on the person and his or her development, we're not only helping that person avoid substance use, that same vulnerability is linked to many other outcomes. And this is where we flesh out the number of evidence-based response, again, in line with the UNODC and WHO standards, that exists not only in the age where initiation of substance use is usually seen, which is adolescence, but we can start way earlier. And this is what the first step, where we start thinking, you know, that developmental message of like, no, we can start earlier. How early? Way earlier. We can start from the time the child is born. Actually, when the time is still in fetal stages, in the womb of the pregnant mother. So I mean, that's how early you can start, and they have interventions documented from that perspective that exist, you know, with the evidence of the you know, as I said again, I echo it, UNODC and WHO quality of evaluating evidence that as early as when the child is in the womb of the pregnant mother, there are interventions that can prevent that child from using substances when the child is in adolescent. That's kind of a revelation for policymakers. Oh, we have to start revising what we need, what we have to do earlier is better. And then you see the interventions also are not only structured in terms of age, but in terms of the social structures that you can intervene with, the family, the school, the community. There is many actors that can interact with that developing person at different ages of development, but also there are interventions that can be split into different kind of containers. You know, they see like the color green, which are universal interventions anybody can benefit from regardless of the level of risk that are in. There are interventions that are in orange or yellow, and these are interventions that are selective for a subgroup of the population that are at higher risk than the average population. And there are also interventions that are indicated, meaning that, you know, there are interventions where we can start addressing particular symptomatic issues in certain individual before they progress into something more significant. So basically that helps a lot in terms of changing the mentality and mapping out the services that exist. But needless to say, one of the main social institutions we were supporting was the family. Given the context of a family, you know, it's a structure when it's affected, it's a relationship, and we go into the details later, but it's an institution that carries a longer term effect. In a developmental perspective, the people in that institution interact with each other for a long period of time. So that momentum is a key thing to support. And that's why we're developing several tools of parenting that are in different contextual situations. Raising a child is not the same if you're in a context of stress, or rather than a normal context, in a sense of stress when you are in conflict, in a conflict zone or in a displacement zone. When you're parenting under COVID-19, that level of stress, all of these things are, you know, supportive for the family structure and it's a key institution we have been supporting for quite some time under that vision of the prevention standard. And I want to raise with you a new development that renew as in like 2 weeks ago. The UNODC, as part of a larger guidance development group, have just participated in the issuance of these new WHO guidelines on parenting intervention to prevent maltreatment and enhance parent-child relationship for children 0 to 17, where there have been specific, actually 5 recommendations with strong evidence on why it is important to focus on that institution. The recommendations are parenting intervention need for parents and caregivers that have children 2 to 17 years old in low and middle income countries, particularly. Focus why it is important because of the context of the need to have that social structure around the children given the context of stress that they can go through. Parenting intervention and caregiver for children aged 2 to 10 years globally. That's the second recommendation. And parenting intervention for parents and caregivers and adolescents aged 10 to 17 in low and middle income countries. That's for the higher age adolescents as well, not the, so basically also they can still carry an influence for 10 to 17 years old. The fourth recommendation is on intervention for 0 to 17 caregivers with children 0 to 17 living in humanitarian settings in low middle income countries, and also parenting intervention for children 0 to 3 years old. So basically that age group is important. So that gives you the general context for the WHO guideline, sort of a level of value of importance of why this institution is a key thing for prevention, but also you will appreciate why it is not only prevention of drug use, prevention of so many different health and negative outcome by focusing on the similar characteristics of change. We have been working in humanitarian settings, and you will hear a small intervention in terms of how we work in humanitarian settings. Humanitarian settings, I'm talking about conflict zones, I'm talking about natural disasters, which unfortunately are on the rise too, and displacement into different contexts of work. So aside the family, we're working a lot on social and emotional learning skills in terms of life skills development in the school setting, and we have several packages to this extent. That's not new, so that's why I will not focus a lot on it, but we can discuss it in more details. We have been working in many countries around the world in terms of availing that policymaker level, but more, what I described at the prevention standard was more on a policy level, top-down approach, but from a bottom-up perspective, meaning service providers giving them the tools to work with, is what you will see on the slide, rather than the policymakers that we've almost reached many countries. And the tools I'm talking about are common denominators of many strategies, whether it is prevention of violence against children, preventing of potential recruitment of violent extremism, as well as helping adolescents in terms of preventing and promoting mental health. You will see the element of parenting skills and life skills component embedded. A new development also that we have, and we will talk about the development we have on the parent skill in another presentation. The new development we have is we're providing new tools for how the law enforcement can be engaged more effectively whenever they are engaged, without being an invitation for working in this regard in prevention of drug use in schools. We're engaging a lot in youth, with youth, and I think globally you see the more, the stronger engagement of youth in terms of global changes in many diverse aspects of work, let alone in the drug response and healthy development debate that my colleague Sue will talk about it in more details. The kind of work in terms of changing that culture of thinking about prevention, you will see we have monitored how the Commission on Narcotic Drugs is kind of raising resolutions. And we saw that the introduction of the prevention standards in 2013 in its first version, before it was UNODC WHO prevention standards, when it was introduced, the number of resolutions by our commission, which is our parliament that take decision in terms of what needs to be accounted for in terms of priority responses to countering the drug problem, you see that the average raised from 20% of the resolutions being less than 13% of the resolution on average were on prevention before the prevention standard. It rose to 40% on average after the introduction of the first standards. But of course, there's a weaning out and a sort of a weakening of the attention. 2018, the revised version of WHO was introduced, and you will see an additional rise in the resolutions that member states are taking in terms of taking action on prevention. But that developmental perspective culminated most recently, last CND actually, with the resolution particularly focused on early prevention, and early prevention talking in terms as early as starting as the embryonic stage of development and infancy and beyond, which is a new way of working for policymakers and member states to focus on that early stage of prevention. That for us was a very refreshing momentum in terms of taking action, and the momentum that we are supporting within this CND that's coming in a couple of weeks on to see how we can move from just a resolution to action on the ground, supporting member state in meeting their response. I will stop myself here in terms of a presentation, but pass the floor to my colleagues who will talk to you about more interventions and developments within the specific context of the family, the youth, and the guidelines on law enforcement. Moving forward, I'll pass the floor back to you, Chair, to organize.
Thank you so much, Wadih. Yeah, thank you very much for the presentation. Ali, are you ready?
Yes. Do you see my screen?
Yes, we can see the screen. Thank you so much.
Perfect. So thank you so much. Thank you, Olivia. Thank you, Wadih.
Sorry,
I'm going to
play settings. Sorry.
To take down, yeah, no.
Olivia?
Cool. Cool. So I'm going to discuss or talk about the UNODC Family Skills programs in terms of the progress, the development, and reach in diverse contexts, in terms of humanitarian context, the low resource context, earthquakes, natural disasters, and so on. And I'm going to start by showing this is the international standards on drug use prevention developed by the UNODC and WHO, which is the compass to all our work at UNODC. And then I'm going to talk about what is healthy parenting, how is it essential to the development of children, or to the early development of children. First of all, parenting supports the child's adjustment beyond their own individual resilience into the different stages of development of a child. As well as, we know through research and so on that harsh and inconsistent parenting predicts poor outcomes in the future of a child. And this includes drug use, low school attainment, delinquency, poor mental health, and other negative consequences as well. That was also mentioned by Giovanna and Wadih previously. And then in this context, we always know that parents always need support in any context it is, that we will mention also in details later. So what do families need during these stressful times? What they actually need is that resources that strengthen the protective factors within the family. And by this, we mean the communication within the family, the trust, the problem-solving skills, and the conflict resolution. In addition, what families need is they need skills and ways on how to deal with their daily stress. Parents need always the skills to learn how to listen to the children and talk to them to create this positive family environment. And then parents need to know the value of using both love and limits in dealing with their children. So they don't really use love the whole time, or they don't put limits the whole time to children, but basically making a balance between them. And they also need to learn how to encourage the good behavior in the children, as well as discourage the misbehavior, as well as focusing on the relationships and creating opportunities to play with the children. And all this is actually given in the tools developed by the UNODC. So the role of the caregiver, the primary caregiver, can play as a protective shield, or it could complicate the stress put on children, especially during war, for example, during conflicts. And the family interaction basically is always predictive of the children's, attitude and adjustment in conflict settings. So we also know through our research and through, screening the resources on family skills that there is a significant lack of family skills programs in contexts, especially in contexts of conflict and war. So what are effective family skills programs? What makes an effective family skill program? First of all, those programs are programs that aim to strengthen the family protective factors that I already mentioned before, just communication, trust, problem solving, and conflict resolution. Of course, each according to a specific culture. And this is why we always adjust our tools at the UNODC to the different cultures. So such programs always include the opportunity for the parent or the primary caregiver and the child to spend positive time together to create this positive child-parent relationship as ways to, in strengthening the bond within the family and the attachment between parents and children. And usually the programs always have a focus on this relationship between the parents and the children and the behavior change within the child. And for this, I want to show you this model that it's basically a multi-level parenting and caregiver support delivery model for families living through challenging contexts, which basically shows the different packages that are used according to the level of intensity of resources, basically how available the resources are, and this is versus the breadth of reach of each program. And I will explain it more in details throughout the presentation. So the first level is the level 1 of brief parenting advice. And this is where we provide leaflets which provide basic parenting information to caregivers in war zones or in conflict settings. For example, the first example I would give is in Syria, where we distributed 3,000 leaflets in 2 days. The return rate on these questionnaires, which were filled after distributing the leaflets, was 59.5%. And the parents or the families who received those leaflets and answered the questionnaire thought that it was quite a great deal that they received this parenting information, which is actually a great deal, right? So thanks to also Ala Khan, who should have been with us today for conducting the study post the implementation or post the dissemination. We also sent, we used the same parenting leaflet adjusted to the case of situation of Ukraine. And this is where we reached 11 million people. And here you can see the breadth of reach of those leaflets, right? So it's at level 1. And most recently, we have also disseminated such parenting leaflets in Turkey, Syria, Lebanon, and neighboring countries after the earthquake that struck the region, where we offered caregiver support in terms of parenting information.
Sorry to interrupt, Ali. Sorry to interrupt.
Please.
I was just going to ask, at the top of your slides, are you able to change the display settings? We might be able to see your slides slightly larger, if that's okay.
Sure.
Yeah.
So,
and swap presenter view and slideshow.
Perfect.
Thank you so much. Yeah, perfect. Thank you. Sorry to interrupt.
No worries. So do you see the diagram properly? Now you see it. Yes. So the level 2 of this model talks about, so shows more of a detailed parenting advice tools. And this is where we provided a parenting booklet that was followed by a conversation group. And here, some of the examples of such booklets: caring for children through conflict and displacement, caring for children in crisis situations, caring for a child during COVID-19. So basically, each booklet is adapted to a specific context. And this would be the general content of such booklets, right? So talking about what the child might be experiencing, how to care for teenagers, providing warmth and support, how to deal with fears, anxieties, how to spend time together, fighting aggression, and so on and so forth. Such booklets also tell parents how they might be feeling during such, in such situations, how the children might be feeling. Moving on to level 3, which is more of it's a broad, more interactive sessions, tools or programs. And with this, I could give the example of the UNODC Strong Families program, which is made for families who are living under stress situation. It's a brief program or tool. It's of course evidence-based, and you can see by this the different studies that we have conducted at UNODC as well on the effectiveness of such programs, which actually reflected the positive effectiveness, positive impact such programs have on families when it comes to mental health, when it comes to preventing risky behavior. That includes all the negative consequences we already mentioned before. So this program, the Strong Families, is also suitable for low resource settings. It's an open source available to everyone. No royalty fees have to be paid. It's cost effective, so it doesn't really need a high budget to be implemented. And so far, we have implemented this program in over 40 countries. We have reached also over 2 million beneficiaries with this program. And in this slide also that was shared already by my colleague Wadih, we show the reach that these programs have. This tool has spread around the world. And the last level is the intensive family interventions, where there was where we coupled a caregiver sessions into a TRT, which is teaching recovery techniques for children who have post-traumatic stress, and we have of course also demonstrated the effectiveness of such tools through scientific studies, which makes it evidence-based, of course, and in line with our standards, prevention standards. And this was one of the products of such a tool, where you can see the children trying to how they deal, right? How we train them to deal with the stress or the traumas. And we have also so in the context of COVID-19, we have developed an online platform. I mean, the COVID-19 has speeded up this developing this tool. It's an online platform for training facilitators online and remotely, and this is where they can access the material into the tools, our tools, and do the homework, which is basically which helps them implement further this tool. And then we also developed the Family United program. After the research, we found out that most of the family skills programs are developed in the context of or for high-income countries, and Family United was developed for low and middle-income countries. We have piloted already in Indonesia and Bangladesh, and the dissemination is right now ongoing. We have generated positive results, which also reflected the effectiveness of such program, and soon you will be able to check the publication online. That was it for my part. I would like to thank Dr. Al-Khani, my colleague, for having me also put together this presentation. Thank you so much. I would also pass the floor on to my colleague, Sue.
Thanks so much, Ali. And I believe Olivia is also helping me with putting up my presentation. Yes, thank you. And if we can put that to full screen. Great, thanks so much. Thank you. Good afternoon, everyone joining today. My name is Sue Hong. I work with the colleagues who kindly just given their presentations just now in the PTRS section of UNODC. And I work with more of a focus on our work with youth and for youth. So Wadih and Ali have just now given or gone over the principles that base our work on prevention at UNODC, as well as the program packages for family skills and trainings that are rooted in the standards that Wadih was mentioning. And next up, I'll be introducing the Youth Initiative on Drug Use Prevention and the ways in which we've been engaging with youth in promoting drug use prevention here at UNODC. So I first, with the next slide, I wanted to first start out by flagging the fact that supporting the meaningful participation and empowerment of children and youth, as well as their protection, is one of the three cross-cutting commitments that UNODC strives to achieve as we work towards achieving the mandates under our thematic areas. And of course, for us, for PTRS, that we're prioritizing evidence-based prevention of drug use when addressing and countering the world drug problem. And so this nicely leads into the framework that we have currently in place to achieve these goals, which is the Youth Initiative. So next, please. So the UNODC Youth Initiative on Drug Use Prevention was launched in 2012. So actually just last year, we celebrated our 10-year anniversary with the Youth Initiative. And it was first initiated as a platform for youth to share their experiences, ideas, creativities, and also to get their support on creating their own substance use prevention efforts in their communities as well. And currently we have two tracks through which we try to engage with and support youth. The first would be the youth forum that we hold every year, and the second is the DAPC grants. And here on the right of the slide, you can see various snippets of the activities that we've had throughout the years, throughout the last decade of the Youth Initiative. And so with the next slide, I'll be introducing briefly what the Youth Forum is. So it is a global annual youth event that we hold every year in conjunction to the CND, the Commission on Narcotic Drugs. It is held on the sidelines of CND, so it's also held during March. Up until now, we've had 11 youth forums with over 440 participants coming from over 100 countries, and we look forward to engaging with more to come. And through the Youth Forum, we aim to connect young people from all around the globe who are active in drug use prevention or health promotion in their schools or communities, or even in their youth CSOs. And it holds to serve as a platform to educate, engage, and empower. And you'll be hearing a lot of these 3 E's as throughout my presentation to better protect the health of themselves and also of their peers. So they come to learn about, what is effective prevention, what is evidence-based prevention, to network with other youth, to be empowered, to be more active in their communities, to advocate for drug use prevention. And during the 3 days of the forum, we also provide the opportunity to bring the voices of the youth to the global policymaking arena. And so the youth come together to jointly develop and deliver a statement that holds their aspirations and messages for the future during CND. And with the next slide, I'll give a bit more context on these big 3 E's with educate, engage, and empower. So through the Youth Forum, we support the youth, as I mentioned, in learning about effective evidence-based drug use prevention strategies. I think throughout the years that I've been able to observe and participate in the Youth Forum as well, it's been gratifying to also see a lot of the youth leave the forum with the realization that the typical just say no to drugs campaigns alone don't work, and that there's also science and data behind effective prevention, which again, as my colleagues have iterated before, it's not only effective in prevention only drug use, but also other risky behaviors as well. So with the Youth Forum, we also aim to connect young people with other young people from around the globe who are also similarly interested in drug use prevention and youth empowerment, so that later on they can also become each other's resources and support networks as they move through. And lastly, to really to be able to empower the youth to become active leaders in their schools, communities, youth groups, youth CSOs, to advocate for substance use prevention and health promotion. And so through the Youth Forum, we really hope the youth do meaningfully resonate with the learnings and have those aha moments to take back home with them. And we are right now currently preparing for the next Youth Forum, which is actually coming up in a couple of weeks. And we're also excited because it's going to be the first in-person event since the pre-pandemic era. And we're excited to be able to engage with the youth again in person. And of course, we also hope to be able to reach more and more youth throughout the years and to share more opportunities of growth for them. And with this slide, I just want to highlight that just a couple of examples of how youth do continue to work in their communities after, as a continued experience after their participation in the Youth Forum. Some do so in conjunction with their career development. Some, as part of truly voluntary actions, in their schools or universities, and some as they are part of youth organizations. And so they've done so either at the local, national, or international levels. And the below three are just very brief examples of them. The first one on the left you see here is the Youth Participation Handbook. And so this was actually a project also driven by the Youth Forum participants. It's a handbook that was developed for policymakers, community leaders, other stakeholders on how to best or how to better involve and engage with youth on when doing drug prevention work. And so the Youth Forum participants provided their inputs on recommendations on how to better engage. So a list of to-dos and also a list of what not to-dos, things to be aware of as adults try to engage with youth in their work. And this is also available at our Youth Initiative website. But of course, if the slides are shared, I think you can also click on the link below to get to the resource there. And the next example is Listen First. So Listen First is a global campaign that UNODC developed and disseminated throughout the recent years. And this was to further promote and advocate for the importance of evidence-based prevention. It's meant to support parents, caregivers, people working with children or youth to support their safe and healthy development. And so in this particular case, a Youth Forum participant from Norway thought it might be a good idea or thought it'd be a good complementary material to have in Norway to further disseminate, these prevention messages in her own country as well. And so she took the initiative in translating the Listen First materials into Norwegian, and she did this through the youth organization that she was actually leading at that time. And I believe she was also, very actively coordinating with her government as well, and was supported by the Ministry of Health as well. And so with a collaborative effort from the youth of this youth-led NGO, they have availed this Listen First, the second phase of Listen First, into Norwegian. They've disseminated it, and now they are also currently working on adapting the latest third series, which is the Super Skill series, into Norwegian as well. So that is one other example. This very last one on the right, it's more of a creative, collaborative output that is created by Youth Forum participants. It first started in 2021. It's a youth initiative magazine. It's a creative outlet to share and promote youth perspectives and reflections on drug risk prevention and health promotion, and why it's important that we invest, and why it's important that it's placed on the agenda. And now it's been expanded to include more youth alumni as the youth community continues to grow year to year. So currently we have 3 issues out, and the 4th issue is on its way. And so with the next slide, I'll talk about the other track that we through which we aim to support prevention efforts with and for youth. And this is a DAPC grants. So DAPC stands for Drug Abuse Prevention Center, which is also an NGO in Japan that raises, the youth volunteers of DAPC actually raise funds within their own communities, which is then donated to or contributed to UNODC. And NGOs are invited to submit, applications for proposals on drug use prevention activities projects that are centered and that involve and also target youth. And so at UNODC, we evaluate the submitted proposals on, of course, a technical, qualitative perspective to select the final grantees. And so with this grants program, we've been able to, we've been awarding small grants to NGOs and CBOs that are from low and middle income countries to support their work in drug use prevention. Again, that is centered around engaging and with empowering youth. So you can see that the entire process by which this grant, the framework of this grants process, I'll say, is really the embodiment of the youth initiative and the spirit behind it. As you see, it's really from youth to youth and for youth. And next, please. Since 2012, throughout the last decade, we've been able to award 139 grants in 55 countries. Here's just a couple of examples of where we've been able to support communities and countries And of course, we also try to take consideration of the geographical balance as we try to support communities, and we hope to continue to be able to reach more people and countries in the years to come. Lastly, as I'm aware that we have a specific focus in terms of region today, I thought I might share this slide, which is has a bit of a zoom in on the African continent. This is an accumulative graph or map of the last 10 years throughout the youth initiative. It shows you where we've had youth being engaged with us for the youth forum, as well as where we have been able to benefit communities in Africa through the DAPC grants. And as we are now stepping into the next decade, we hope to be able to reach more youth, more CSOs, and more countries around the world, and of course, including Africa. And as I finish up, I will finish up with this very last slide, which reiterates the message from the youth of last year's Youth Forum. As you can see from their quote up here, I think it really clearly does indicate their readiness and willingness in being involved in the discussions and actions that actually impact their future, right? So we are looking forward to a good year also this year and the new decade. And yes, that is it from my side. Thank you very much for your attention.
Thank you so much, Sue. A very colorful presentation with all the youth and their activities. It's always nice to see what the other countries are doing and how we can get involved. And I think that will come out in the chats. Just a reminder to the participants that they could, if they have any questions, they could just pose it in the chats and we will address it from there. Thank you very much. I give over to Dr. Ziad.
Yes, thank you. Can you see my screen?
Yes, we can see it.
Okay, perfect. My presentation is about the defining the role of law enforcement in substance use prevention within school settings, which is a guiding document that we have been working on it. My colleagues Wadih, Ali, and other experts as well that now will talk more about it. It started by discussion around what we know about from evidence on the effectiveness of law enforcement in substance use prevention inside schools, and the evidence shows mixed methods, that there are negative or null effect by having law enforcement officers doing prevention work inside the schools. There is one study that shows positive effect, and there is mixed effects as well. And the take-home message here was that there is, despite that there are negative effects, but there are also limitations to these studies. And the perception of the role of the law enforcement officers still not too clear, or there is some variation. It depends on the studies and the context and the circumstances around these studies. So here the question was that what is the potentiality of the role of the law enforcement inside the schools, and how can we do a shift in the mindset of the perception of the role? We worked on the paper that was a scoping review, and also we suggested a methodology called the Delphi process, which I will also discuss it. And just today I looked up the statistics around this paper, and it shows that in terms of accessibility from the website of the journal is increasing over time. So I don't know what that means, if this topic is becoming more and more important, but the accessibility is increasing over time for this publication. So the Delphi method is usually used when there is not enough scientific evidence around a topic that needs to be more investigated. And for me, as an epidemiologist, I always believe in randomized clinical trials and systematic reviews and meta-analysis to really show effectiveness of an evidence. But in a case when there is not clarity around the evidence and we need to have a guiding document, the Delphi method comes in to create a synergy between what we know from science and also what's the opinion of the experts, and how we can create synergy between them and to make them meet halfway as well. So when we have diversity of opinions, the Delphi technique bring in this diversity and to strengthen the process. So that's what we did in this Delphi method. And now I will take you through the stages. So first we started with the process on looking at the knowledge gap, which is the scoping review and the project proposal. And then we identified experts in the field through the literature or through the people that we know them from the international standards experience. So then to invite them over. And also we had a panelists selection of key informants. And then from there, we had experts meeting to discuss this topic with them and to see what works, what doesn't work. And then based on the resolution 61.2, we developed a not-verbal and a questionnaire survey that was sent to all permanent missions in Vienna. And then we received back feedback. And then we had a panel meeting with the experts and the member states representatives. And post this first panel meeting, we had the first draft of a guiding document, and that was developed and sent out to all experts and the member states representatives, which they looked into it and they gave feedback. And then we had an updated version of this draft, and then we started to do sensitization in two arms. One arm to sensitizations for the policymakers, which was presented in the CND in 2021, in 2022, and there were also experts groups meetings in Iran, Kazakhstan, from Iran, Kazakhstan, Kyrgyzstan, Pakistan, Tajikistan, Turkmenistan, and Uzbekistan. And then there was also scientific platforms as well to do sensitizations, just to share the process with them. And this is happening, this project, which was the EU SPR and the ISSUP and the GLEFA 2022. And then we had the training material was also developed and was piloted in Panama. And then there was a feedback received during the training, which was also integrated into the guiding document. And then the draft was sent out to the experts again. And we had our last meeting in November of 2022, which was a hybrid meeting between people coming in person to Vienna and people participating online. And now the final publication will be in March. So we have a paper for the CND that will be presented in March this year. And I would like also to acknowledge the INL as well for their support. Thank you so much.
Thank you very much, Dr. Ziad. Yeah, and I think now the floor is open for the questions. I was listening to the last presentation on law enforcement, and I was very interested to find out what exactly works and what doesn't. And I am looking forward to the document, the final document. I don't know whether we can also be trained.
If I may, Leigh-ann, I mean, just to add a bit of context to this thing, Ziad went through the process of its development, which is key. But you know, I think the background of why it was developed is also important.
Yes.
We know in many countries where we're implicated that security-based ministries in general hold to the drug responses from the supply side mostly, but also in certain cases the ministries of interior have funds that they're using for law enforcement implicated work from one end. So for drug prevention, I mean work from one end. But from the other end, you saw when I was presenting the standards, you saw the social institutions that we're working with, law enforcement was not there because we do not have any evidence of packages that are in line with the standards that really work on, reflect on like law enforcement being implicated in that response per se. The third piece of the puzzle was, you know, also in the vulnerability matrix that was reflected, that context of development required a safety element around the child. And we know from an environmental perspective that law enforcement could play an element of safety. Maybe, and this is where Ziad was talking, maybe that's why there's not enough reflected evidence in the literature in terms of how environmental policies can play a role. Maybe it is also the case that law enforcement are not the best agents for doing manualized program and working more on environmental policies. It could be like several factors, and these but at the same time there is work. There's a workforce that's implicated on this. So when we were writing the document, it was a thin line to cross because there is strong resistance in many countries against law enforcement being implicated to be part of the school system and working on prevention. And there are, from the law enforcement, a good affinity. They want to be implicated. So that's why the document was written in such a way, you know, guided by science as much as possible, was written in such a way, okay, if you are implicated as a law enforcement officer, so the audience are primarily law enforcement officers, in the field of prevention, in schools, that guiding document will not help you have a tool in your hand to work on prevention, but will shape the way of thinking you have and closer to what the science is saying in terms of the standards, so that you probably could play a more effective role in the response. While doing so, by changing that frame of mind, it will bring that law enforcement officer to the larger system of prevention and other agents of prevention that exist, may it be the social affairs, the educational sector, the public health sector, to think along the same line and bring them together and make it more effective. So that's a long introduction to tell you that after, with all of these variables, the document was done, and I really kind of commend Ziad and also Ali and other colleagues on this, because it was not easy, because of the polarity of thinking, in such a way like to talk to these frontline law enforcement officer to really help them reshape how they're thinking and shape their momentum moving forward. And hopefully that will bring the message together moving forward. So it's a key document that we're looking forward to deploy. At the same time, it is really kind of as a front page written that at the level of the stage of science it is in, it is by no means an invitation for law enforcement officers to be implicated in prevention if they're not doing so, because we have lots of evidence of other agents that might be more effective with better tools, because it's not the evidence-based program that is important. Sometimes the person behind it could play a key role in terms of facilitating this content. So it's work in progress, but at least now we have a good map forward in terms of engagement.
Leigh-ann, you're muted.
Leigh-ann, we still cannot hear you. There might be a problem with the sound. I'm sorry.
Apologies, I needed to turn off my camera. Can you hear me now?
We can hear you clearly now, yes.
Okay, great. I just wanted to find out if there are any questions. I can't see any that we should address.
I think Radolf might have sent you a couple on WhatsApp.
Okay. Okay, let me just quickly take a look. Is there any funding support for CSOs that provide prevention services, especially in South Africa, and how do we access that? Patrick Tutubala is asking.
Well, unfortunately, the way we're operating is really providing technical assistance to the member state based on requests and based on availability of resources. So basically, to answer this question is we're here to support and guide in terms of what works and what does not work, and maybe kind of guide the proposals that are put forward. Sometimes we do get resources for technical assistance for specific countries where we engage with our regional or country offices to avail these services. Now, in regard to directly supporting civil society organizations engaged in prevention, my colleague Sue talked about a grant mechanism that exists within the work that is supplementing the activities being working forward. Maybe, Sue, you would have a general sense in terms of where we stand with regard to the DAPC mechanisms. But when it comes to South Africa, I mean, we invite whoever is interested to really engage with the field office, to our regional office there, and see what sort of activities are in existence there. But we're talking about from a general perspective how to guide for us as headquarters, as a thematic section, to guide the response more in line with the standards. But the field operation is more sort of spearheaded by our field offices, except for the grant mechanism that my colleague Sue will might have a few insights on.
Sure, thanks so much, Wadih. Yes, of course, during my presentation, I spoke or I talked about the DAPC grants, which is meant to be supportive and a direct source of funding for drug prevention efforts and projects in low and middle income countries, but they do need to be, involving youth in the planning implementation process. So there's a youth focus that should be incorporated into the project proposals. The program for this year, for 2023, is not out yet. It's currently being planned. But from the experience from last year, I mean, it's a global call, so it's not specific to a specific region, so it's global. But as I was mentioning during my presentation, we do try to take consider of the different regional diversities and ensure that there's not one, it's not we don't only provide the funding to a particular region or to a particular country. So it's global. We try to keep the geographical balance there. And if you're interested in knowing more about these grants, we do have a dedicated website on our youth initiative website where you might find more information about this. And if you'd like to know more, please do reach out to us. I think Olivia and the organizers will know where to find us.
Okay, because there was another question on how to apply for the grant. So I'm now listening, and I think, Sue, what you are saying is they should visit the website.
Yes, so in the case for last year, it was a noble call. We had disseminated it through our social media on our website. Interested applicants were able to download directly the templates, the forms that were needed to submit applications for the proposals. As I mentioned, the grants program for this year are still in the making, and so they've not been announced yet, but this is just based on our experience up until last year.
Okay, thank you so much. I think that was the questions that were posted, and they are answered. Thank you very much to the UNODC team. Yeah, I think we are reaching the end of our webinar, and I just want to say thank you so much to Radolf and Olivia for assisting in the background and making everything possible for us to have this webinar. It's very important to Namibia, especially because prevention is something that has taken a back seat, and I think evidence-based prevention is it's so important. Listening to the webinar now and to the presentations, I think we should go back and, like the presentation said, we should look at what exists and the infrastructure that we still need to work on, but also look at the different actors and try and engage as many actors as possible, making sure that it is evidence-based and it doesn't cause any harm. Yeah, so with that in mind, I really just want to say thank you to the UNODC team.
Thank you,
It's
Leigh-ann,
really been a pleasure. I can't see your faces, so it's a bit strange now.
I just want to say also thank you for inviting us and
Yes.
to this podium and to avail this opportunity to share these new developments. We really look forward to sort of most of the things I discussed aside the prevention standard and the family skills. You know, they has been happening for a while, but there are lots of new tools being developed, and we really hope that these new tools as well will come to the right channels through your support. And already, like the fact that we had this discussion, many of the things are almost out. They're not out yet, but that was an opportunity to also to sensitize your audience that they're coming up. There are more and more tools coming up, and hopefully we'll have the chance to kind of deploy them in for whoever are needing them. But also they may be tools that will help those implicated in prevention also themselves mobilize further resource and advocate for the work that they're doing moving forward.
Yes, thank you very much. Okay. I think with that, we have reached the end of our webinar.
Thank you very much, Leigh-ann. Thanks, everyone.
Thank you very much for the opportunity today.
Thank you so much. Thank you.
Bye.
Bye-bye.